Good day, everyone. Good day, class. I'm Ibrahim Ahmed Orodupe. I'm here this morning to take you NSC 501, which is Community Public Health Nursing Practicum 3. These are my course objectives. Descriptions. Nurses enrolled in this practicum course, we have extensive practical experience in community and public health setting, with an emphasis on health promotion, illness prevention, and the management of health resources across various populations. Students will apply their theoretical knowledge that we have in class and clinical abilities in real-world circumstances. Now, these are my course objectives. At the end of this clinical posting, each student should be able to apply model of community health planning, community diagnosis, care plans, implementations of care, and evaluations or evaluation in care of health needs of the community. At the same time, students should be able to demonstrate skills in consultation and counseling of patients. They should be able to demonstrate skills in the management of childhood illness and common endemic diseases at the primary health care facilities. At the same time, you should be able to participate in skill health programs and health promotion activities and conduct home visits for follow-up and community participation purpose and as applicable. Now, going by introduction, community and public health nursing practicum serve as a vital component of nursing education. This helps in bringing theoretical knowledge with practical experience in diverse community settings. This course is designed to immerse students in the complexities of public health, emphasizing the importance of health promotion, disease prevention, and management of health resources. Now, I'll go by defining what community and public health nursing practicum is. It's a structured, hands-on learning experience designed for nursing students to apply theoretical knowledge and clinical skills in real-world community and public health settings. Now, we have models of community health planning. Community health planning involves a systematic approach, gradually, not just once. It's a systematic approach to identify health needs of that particular community. What type of health needs did they need? What are the type of health that they need in that community? Now set a priority, how important those health needs is, and develop a strategies how you have to plan, how you are going to meet up with their needs and to improve the outcomes within the community. Several models exist to guide this process. Now, example of number one model here, we have the proceed model. And one is community assessment model, logical model, and community mobilization model. I'll pick this one after the other. Now, these are my models that I mentioned earlier on: proceed model, community assessment model, logical model, and community mobilization model. Now, what does proceed model use? This is developed by Green and Quetta. This model is widely used in health promotion planning. It consists of two main phases. Number one is proceed. That's before. Proceed. Focus on assessing the community needs. You need to be with your community. Ask them. Be with them. Know what they need. Their needs based on social, epidemiological, and behavioral factors. Some of these, you need to know their needs. Now, after you've recognized and identified their needs, the next one is you now proceed. You continue on the next phase. What is the next phase? Emphasizing the implementations and evaluations of the health programs. This model encourages stakeholders' involvement and promotes a comprehensive understanding of health issues within a community. Now, community assessment model. That's the next one. This model emphasizes a thorough assessment of the community health records. Health needs. Thorough assessment. Their resources and the challenges. Their health needs. What are the things they need in that community? Resources. What are the things they have? The type of food they are eating, the water they are drinking, where they live, their environment, the resources that they have, then the challenges. You need to understand, assess all some of these things. Now you have to collect data, gather these qualitative and quantitative data through survey, focus group, or existing health statistics. Now you have to analyze it, identifying key health issues, and prioritizing them based on community input and available resources. Now, action planning, developing strategies and intervention that align with what your community needs. Now, logic model. The logic model is a virtual representation that links resources, activities, output, and outcome of Earth programs. It has planning tools to clarify the programs, objectives, and experience impacts. Now you have to get an input. Those are the resources invested in the programs. And the activities, the action you have to take to achieve those goals. Now output, the direct result of the activities. Now outcome, at the end of all these inputs. So what are your results? The outcome is short-term, immediate, and long-term changes. Now the last model here is community mobilization model. What does this mean? These models emphasize empowering communities to take charge of their own health. You have to put them into actions. You have to engage them here by mobilizing resources, fostering collaborations among stakeholders. Now we have engagement involving the community members and their leaders in planning for their own care. Capacity building, strengthening community skills, and the resources to address the health issues. What are the things they have? What are the facilities, the type of food they have over there? Now the sustainability, ensuring that health initiatives are maintained and adapted over time. Now my conclusions. This community public health nursing practicums is a transformative experience that equips nursing students with the essential skills and knowledge needed to address the health needs of diverse populations. Through on engagement in real-world settings, not what you have been taught in class, these have to be in a real-world setting. So not only apply theoretical concepts alone, but also cultivate a deep understanding of complexities surrounding public health. This practicum emphasizes the importance of community assessment, collaborations with interdisciplinary teams, and cultural competence care. Now, as I said earlier on, if you have any questions, if you need any clarifications, you feel free to drop a message for me. Then you can mail me. I hope that this class is so much interactive. Thank you and God bless you. See you in the next class.